Dear Sir or Madam, you've been potentially exposed to hepatitis C, hepatitis B, and HIV through unsafe practices by your healthcare provider. Please come to our facility to be tested. These were the opening lines of an official letter that I received from Nebraska Health and Human Services in 2002. This letter turned my world upside down. I had just recently completed a strenuous course of chemotherapy for stage 3 breast cancer. And now I had a second life-threatening disease to combat. To make matters worse, I had contracted the disease through obvious medical error. The oncologist who had treated me for breast cancer was not only my doctor, he was my friend. He was the man to whom I had pinned my hopes of surviving cancer, daring to dream that I could live long enough to see my 3 sons grow into the kind of upstanding man that their father is. But I wasn't the only one who was confused. 650 people in our small Nebraska town received this same letter. After the test results came in, we learned that I was one of 99 people who had contracted hepatitis C through unsafe practices at the oncology clinic. The outbreak thrust our community into deep conflict. 89 malpractice lawsuits were filed, and an atmosphere of mistrust and betrayal permeated our community throughout the years of litigation. You see, we all had gone to the doctor to be cured of our cancer, but we came away with a second life-threatening disease. At least 6 of us have died, not from cancer, but from hepatitis C. And the rest of us have suffered the awful effects of the disease: crushing fatigue, debilitating joint and muscle pain, difficult and expensive treatment, but if left untreated, ultimately liver failure. And it was all completely preventable. Here's how it happened. The oncology nurse drew our blood and then used that same syringe to access a large saline bag to draw back saline to flush our ports. Through repeatedly accessing the saline bag with dirty syringes throughout the day, the hepatitis C virus was introduced into the saline bag and then into all of us. In the morning, the saline was clear, but by afternoon, it was cloudy, pink, with bits of sediment floating in it. Even more unbelievable is that this egregious medical error has repeated over and over throughout the country. The CDC estimates that there have been 50 outbreaks since ours, the most recent being October 7th, a few weeks ago, when a New Jersey nurse reused syringes to administer flu shots. Malpractice is not that uncommon in the United States. My friend and book editor, John James, a retired NASA scientist, lost his beloved son, Alex, to medical error. Since then, he has dedicated his life to working for improving patient safety. His research, published in the Journal of Patient Safety, cites evidence that as many as 440,000 people die every year in American hospitals due to preventable error. Malpractice is bigger than Alex. It's bigger than 99 people in Nebraska. After agonizing over the decision for several months, I took a deep breath and filed malpractice suits against the oncologist and the hospital. What had made the decision so difficult was that my husband had been chief of staff at that hospital and had admitted his patients there for over 20 years. I myself am a healthcare provider, and I carry malpractice insurance. Our 3 sons are physicians married to healthcare providers. So as a family, we have shared the deep emotional and financial challenges of malpractice from the provider standpoint. And now, we've lived on the other side of the issue and know that for victims, it's not just emotional and financial. It's the added heavy burden of compromised health. Hopefully none of you have experienced malpractice litigation, so let me tell you about it. First, the defendants and the victims lawyer up. Then the lawyers collect as much information as they can before deciding whether to take the case to a jury trial or to mediation. In mediation, everyone sits down with a professional mediator who brokers a financial agreement between the defendant's insurance company and the victim. It's solely about money. The insurance company lawyer works as hard as he can to pay as little as possible to the victim, and the victim's lawyer works as hard as he can to get as much money as possible. In our 89 malpractice lawsuits, the issues boil down to three. How did we all contract hepatitis C? Should we be compensated for our suffering due to hepatitis C? And how much money should we be paid? What we did not talk about was this: how can we correct the errors in our community's healthcare system so that this tragedy does not repeat? In our current malpractice system, we assume that when the defendants are liable for monetary damages, they will correct the errors so that there will not be further malpractice for which they are accountable. But the doctors and the hospitals themselves don't pay the claims, the insurance company does. So maybe the healthcare providers will correct the mistakes, but maybe they just put their experience behind them and move on. I believe that malpractice should not simply be a financial private transaction between the insurance company and the victim. I believe that it must be a system that safeguards the welfare of our community. So when my case went to mediation, we asked for more than just money. We came armed with an action plan of 20 steps that the defendants needed to implement to prevent the tragedy from happening to anybody else. The defendants' lawyers just laughed when they saw this plan. But I wouldn't settle without the plan in place. So after 10 hours of intense negotiation, the defendants agreed, although they did not admit guilt. After we signed the settlement agreement with its accompanying action plan, we wrangled with the defendants an additional 3 years before we were satisfied that the action plan had been implemented. This time of 3 years was full of more frustration, anxiety, and litigation. But with the implementation of the plan, I had the satisfaction of knowing that I have done all that I can to prevent what happened to me from happening to anyone else. This satisfaction heals my heart. We are once again at peace within our community. I'm using my experience to champion a new model of malpractice resolution. I call it the Nebraska Malpractice Remediation Model. Here's how it works. During mediation, the defendants and the victims identify the errors and work out an action plan for remediation. Using a checklist, they develop a timeline and a method for certifying completion. A word about checklists. Checklists have been proven to improve patient safety, but I've become a fan of checklists through my experience of being a grandma. My 3-year-old grandson Lincoln is a busy boy. His parents wisely have instituted a checklist to ensure a successful bedtime. Here it is: brush teeth, read book, go night-night. Brush teeth, read book, go night-night. We chant the checklist as we march from the toy room to the bathroom to the bedroom. The checklist works because we can barely get through one reading of Goodnight Moon before I'm fast asleep. And I assume Lincoln falls asleep pretty soon as well. A checklist is exactly what we need in mediation so that we don't miss anything. It was what we did not have present at my mediation, which led to errors of omission, which led to 3 additional years of conflict. At the designated time of review, the parties reconvene, and the defendants provide evidence that they have fixed the problems. If both parties are not satisfied, an extension may be granted, or ultimately there may be fines levied for noncompliance. Under Nebraska statutes, the state is a party to many malpractice suits. If the state would require not just compensation but remediation of the errors, this model could become the norm. The University of Michigan Health Systems instituted a mediation model that required an explanation of what happened. With solely this modest element in place, the number of malpractice claims have significantly declined. I submit that if we require healthcare providers to go a step further to identify an action plan and then prove that they've fixed the errors, healthcare would be even safer. So picture this. You go to your mailbox and there's a letter from Health and Human Services. Dear sir or madam, you've been potentially exposed to hepatitis C, hepatitis B, and HIV through unsafe practices by your healthcare provider. What do? Do you demand not just compensation but also remediation of the error? For the benefit of all of us, for the benefit of those who might otherwise have become victims. At the start of our conflict, I laid in bed with the covers thrown over my head for the better part of 2 years, trying to avoid this stressful conflict. I hated it. But now that I'm healthy, looking back at it from this perspective, I'm grateful for the conflict because it forced me into improving healthcare for myself and my neighbors. Thank you.